Your willingness to open to and connect with that which is scary in you provides a safer place for others to do the same. The trust that you continue to build in yourself is probably the primary thing that we can bring to people that we're supporting.
When it comes to your inner journey of healing and self development, no matter the method you use, the vital point is to practice. If you're ready to transform your life and live with clarity, connection, and wholeness, then you're in the right place. Welcome back to The Vital Point. I'm your host, Jonathan Schechter. As a breathwork facilitator and integration coach, my goal with this show is to inspire you to take action for yourself, whether you're taking your first step on your journey of healing and self discovery or already a seasoned traveler. Truth is, you have the capacity to transform and bring your intentions and dreams into the world, and there's never been more access to so many incredible modalities that can help you on your journey. This podcast will help you learn simple methods you can use to change your life with guided practices and interviews with practitioners doing the work. I want you to feel confident and inspired to take the next step on your own pathway to integration and wholeness, because the answer is found in the action. That's the vital point. So take a deep breath and let's drop in. I have a fantastic episode for you today. My guest is Dr. Nick Bruss, a licensed psychedelic therapist, researcher, and educator. He specializes in concierge psychedelic-assisted internal family systems psychotherapy for accelerated growth. He's also a clinical researcher and supervisor on the MAPS groundbreaking FDA study for MDMA-assisted therapy for PTSD, a lead therapist on Compass Pathways FDA study of psilocybin for treatment-resistant depression. He is a level 3 trained internal family systems specialist. He's an expert in internal family systems, IFS, and is level 3 trained, an IFSI approved clinical consultant, and a 2-time presenter at the IFS conference. He's also a faculty member of the Integrative Psychiatry Institute, a Therasil educator at psychedelic.support, and the co-founder of the Psychedelic Coalition for Help. And also just an incredibly great person to talk with. So this one was just a pleasure. I didn't think that we had enough time. The hour really flew by quite quickly. And there was so much that I wanted to talk to Dr. Nick about as far as different projects that he's involved in and things that I think are not only interesting to me, but interesting to you as well. I made a decision in the moment to go deep rather than wide. And so we ended up uh, having a really interesting conversation about IFS, internal family systems. So IFS is something that we've talked about before on the show, specifically in episode 73 and 23 with Christine Dixon and episode 41 with Justin Martin. So if you're interested in what we're talking about, not only should you get a hold of Dr. Nick Bruss, my guest today, but you can go check out those episodes as well. In fact, learning about IFS via podcasts and books is one of the suggestions that he has during the show. Because we've talked about it on the podcast before, I didn't start exactly at the beginning. So if you're not familiar with IFS, just a real brief synopsis since we dive in sort of midstream. Internal family systems is the work of Richard Schwartz. There's some great books that he's written, No Bad Parts being one that is recommended within this episode. And the idea with IFS is that the psyche, this is not viewed as a unified self, but as a whole system that's made up of different parts. Like think about the different aspects of yourself, the different inner voices, the different responses and reactions and behaviors that are all coming from different parts of you. And some of these parts have been wounded. Some of them are trying to protect you. There's that trauma aspect there. Sometimes the parts get frozen around those woundings. And underneath all of these different parts within this internal family system is your core self. And in the IFS language, you might say that that's the self with a capital S, which is not a part, it's your essence. So, how interesting there that that correlates perhaps with Buddha nature, with the inner healer from the lens of Dr. Stan Groff, and within IFS or parts work, as it's sometimes called, the goal is not to get rid of these parts. It's to understand their role, to befriend them, to help them feel safe enough to heal. So I hope you can see how this is creating so much synergy with integration work, because after we're doing that work, whether it's with psychedelics or breath work or other expanded states, um, even things like shadow work or reparenting, the parts can be kind of stirred up, right? Brought to the surface. And especially if there are these parts that are wounded or protecting us from certain things, we might feel a lot of challenging emotions, things like grief and shame and fear or confusion. So, IFS gives us a map to help us navigate our inner terrain. And that isn't involved in bypassing or over analyzing. It's really about feeling and connecting to these various aspects of ourself. And so, as we get into during the episode, just like in other methods of integration, instead of trying to suppress or sometimes making sense of a big experience, we can meet that part of ourselves with curiosity. We can ask, what is it that you need? Or what are you afraid would happen if you step back, right? Like, we can ask those protector parts, what happens if you're not protecting me? And in the language of IFS, unburden those parts from the role in which they've been playing out. Curiosity being one of the really important things within IFS, and one that I am always fond of. There are what they call the 8 C's within the IFS, sort of work, and curiosity is one of them. There's also calm, clarity, compassion, confidence, courage, creativity, and connectedness. And speaking of connectedness, this is another thing that happens oftentimes when we're in these expanded states of consciousness, is we can connect with this self, this S, capital S self, right? And we can feel that. We're getting a direct experience um, that feels sometimes overwhelming, sometimes bigger than us. And then after that experience, in the afterglow, oftentimes we're left with this question of, how do I get back to that? Or how do I stay connected to that? Or feeling frustrated that that clear connection that we now know is there because we've had this direct experience has started to fade away. And so IFS has been a very important part of my own integration work, as far as helping to bring the qualities and the things that I've touched in my uh, inner work into my life, and how to do that when the high starts to wear off and things start to get real again. Before we jump into the episode, I want to invite you to join the community on School for Blue Magic Alchemy. It's school.com/Blue Magic Alchemy. There you will find a community of alchemists, of practitioners, of people like you that are interested in their spiritual development and supporting each other along the path of wholeness, healing, and integration. You'll find live and recorded sessions for breath work, for meditation. We just added a yoga session. I'll be doing some more somatic work there. There's a meditation course, and so many different practices that can support you in your own inner journey, as well as the support of the community. I'm adding new things all the time there. It's really what I consider now to be the hub, if you will, the nexus point of all my work. And so I would be delighted if you joined us there. It's free to join. There's options to add additional live support if you want that, but it's free to join. Really wanted this space to be someplace where anyone can come and jump in, even if they're just getting started and not sure exactly how to navigate that. I know that that was a big part of why I wanted to get involved in integration work and become a coach in the first place, is just navigating the beginning steps where you're not quite sure where to turn, and there's not always a clear path as far as how to deal with the things that are coming up inside of you and as a result of maybe some psychedelic work that you've done. So hope you can join us at www.school.com/Blue Magic Alchemy. And I hope you enjoy this amazing episode with Dr. Nick Bruss. Really feeling enthusiastic about being here. Dr. Nick, welcome to The Vital Point.
Thanks so much, Jonathan. Good to be with you. As you mentioned, it's been a while in the build up to this, or the run up to this, and I'm so looking forward to it. I've appreciated your work, and particularly the core message about practice. That is where it's at.
Yeah. So speaking of practice, would you like to open up the space here with something that the audience can follow along with and help me drop in too?
Sure thing. Let's. So wherever you're at, if you're driving, obviously that's a thing. Please don't go too far in. But notice this next breath as best you can wherever you're at. Notice this next breath. Great. And now notice this next breath in your body. So where do you feel it in your body? Okay. We'll pick it up a little bit. Next, I'd like you to take the biggest breath you've taken yet today and feel that in your body. One more. So the biggest breath you've taken yet this month, and feel it in your body. Great. Now, having shifted your focus inside to your physical body here a bit more, we're going to take just a few moments and open to listen, maybe even feel, and maybe even be in a little bit of a conversation with a part or some aspect of you that wants or needs your attention. So the inquiry goes like this: what needs my attention right now? I'll repeat that in a moment, but here's how you take it in. So it's not anything to figure out, but it's a question. And normally when we're asked a question, our minds go to work, we try to figure something out. But this is a bit different. This is a deep listening practice. And so when I ask the question again, the invitation is for you to ask the question inside and then listen. You might feel your next breath and listen in the same way that if you were listening for something in the next room or kind of far away, you'd have to get quiet and still. Kind of steady the frame of the camera to get a good shot. So you'll listen, watch, feel to see if anything arises. There's no right or wrong to this. We'll just notice what comes up. So the question for you to ask yourself, to ask inside, and then listen, watch, feel, is what needs my attention right now? Giving that just another moment. You might hear a voice. You might hear nothing. You might feel a sensation. You might feel tired. You might feel a sadness. You might feel a joy. So just for now, in this short practice, if anything came up, just acknowledge it. Say, okay, hi, I see you. In the same way that if you're in a room and somebody walks into the room, you might turn and acknowledge them, just with kind of a head nod. So go ahead and do that inside with whatever came up. And if nothing came up, okay, you can just make that acknowledgement that there was nothing in this moment that wanted or needed your attention. Okay, we'll conclude this practice with the biggest breath you've taken this year. So feel it all the way in. Maybe you hold it at the top. And even let it go with some sound. And when you're ready, bringing your awareness back into the room.
Can I just say I love IFS? It's so great.
Me too, man.
Yeah.
How was that for you? Anything come up?
Yeah, thank you for asking. What came up for me is an awareness that I've been working with recently, especially around the podcast, of staying in a place of authenticity and not needing to perform or fawn or I went through this whole thing recently, like within the end of last year, the end of 2024, where I kind of paused the podcast and I was feeling kind of burnt out with it. And in that pause, in really reflecting and questioning whether I wanted to keep doing it, I came to this space of kind of confronting this part inside that was like, I have to get this person on the show because I want the show to grow, or I want more people to like the show. And whether that was the prime focus or whether it's more important to do something that I feel comfortable with and that really excites me. And yes, do I want other people to listen to the podcast? Yes, I do, of course. But if I'm not having fun and it doesn't feel authentic to my experience, I don't really think that it's worth all the effort that I'm putting into it. So much more of like maybe like a Rick Rubin sort of, ethos. And in this moment, and sort of riding the wave of coming in and talking to you even before we hit record, I was just feeling excited of like, oh yeah, this is the right decision. This is a good person to be talking to on the show, and I'm excited to dive in with you.
Great. Thanks for sharing that. I wish we could kind of poll everyone watching to see what came up for them, but thank you for sharing and naming, essentially kind of naming some parts. What came up, you've gotten in relationship with that part that felt burnt out. That was, burnout was a part of your experience. And I appreciate that you also named the nuance between, you're not suggesting to yourself that, that our drives or the things that we choose into should be purely just one thing. I think it's really helpful to acknowledge, like, yeah, I want to, or as you explained, want to connect with and run the podcast in a way that feels really good to you. And I would even say it's another part that wants everybody else to enjoy that as well. So this work with IFS, it gets nuanced into even kind of polarized or parts that have conflicting wants or needs. And so much connection actually comes out of naming the parts as they are, even if they all don't seem to line up. Yeah, and gotta say, everyone listening is glad that you're also to keep it going.
Yeah. I'm glad that you used the word nuance, because that's exactly what I was thinking as well, with at least my own experience with parts work, and that those working with those parts that are polarized. And not only like I guess I feel like there's one layer of integration work and just doing inner work in general that is learning to love and accept your parts and not push them away or feel shamed or try to, feel like you have to hide them. But also, I feel like a deeper layer for me is that working with that polarization, that there are these parts that sometimes are almost in conflict with each other, or, like being able to hold alternate views
Hmm.
at the same time, being able to change those ors to ands.
Mm. Yeah,
Yeah.
I so agree. I literally have a tattoo that says yes and, because of this, the power of yes and the word there, instead of but tends to like shut it down or kind of either or, whereas and we can include, and IFS is so good at including what's arising. There's a common phrase with internal family systems: all parts welcome. And when we really start to embody that, to your earlier point, is more, I see it as self-love, self-care, self-respect. Like how do we love and take care of ourselves? Well, we notice where we're maybe um, where we're casting certain parts out, or there's I like this, but I don't like that. When we can turn towards the parts of us or the aspects of us that we've kind of been pushing away, or we feel aren't up to snuff, or like are not okay, then as we start to embrace them, then there's just more connection on the inside, which of course rolls out on the outside as well.
I love that. And also with connection, I think another way that parts work has been really helpful for me lately is in relationship. I just recently went to Minnesota and I got to spend some time with my sister's kids, who are 4 and 6. And the 4-year-old in particular, I found just her being, just her personality, and the way that she was communicating and the things she was looking at and the way that she was holding herself to be quite fascinating. And then I came home, and there have been times in the last week where my partner and her behavior, or just what's out in front, is so reminiscent to me of this like 4-year-old, in the best way. Like, I'm not saying it
Mm-hmm.
as a bad thing, but
It wasn't during a tantrum.
no, it wasn't during a tantrum, but also just to keep myself accountable, sometimes moments that I have trouble holding.
Mm.
And so being able to sort of like relate, like, oh, this is this like child part,
Uh-huh.
has really helped me have more empathy and more understanding and more patience
Mm.
for in relationship with my partner. Please, please.
If you're willing, like when you
Yeah.
said it's hard to hold, was it seeing the expression in your partner, or is it kind of what arises in you at other times when that thing that it's reminding you of or you're feeling
Yeah,
arises
I
in
think
you?
it's the second one. Yeah.
Okay,
So it's
great. So
like,
you're
oh, I can
surrounded
just
by great
see it.
teachers.
Yeah. That just helps me, yeah, be more present and less judgmental, and just, okay, cool. This is that part, and I can recognize that. I can be with it.
Mm.
Um Certainly I think I, I'm curious on your take on this, but parts work has definitely helped me, I think, be a better partner, and be in better communication and just have a better relationship
Mm.
overall.
Yeah, absolutely. I'm in appreciation of you kind of identifying some, for myself, I would call them teachers, or just your 4-year-old niece and your partner, of something that they embody that you might be inviting yourself to embody a bit more. I certainly have that with my number of my friends, and my wife in particular. She is such a badass. And she is also She's a trial attorney. She is not conflict avoidant, to say the least. That it has it has taught me how to stay with myself, even in the heat of conflict. And to your other point, the internal family systems model is so useful in communication, in relationship, in business, when we can speak for our parts rather than from our parts. So speaking from our parts looks like, to use the kind of more extreme example, blind rage. We literally call it blind. There's like the person is not have their full faculty to them. It's just this part of likely like rage coming out.
Yeah.
Whereas if I can say to my partner, like, hey, part of me is upset about this, part of me is a little worried about this, then it's me in contact with this part, sharing that with my partner. And we can be on the same team together versus, part of, I'm so upset with you feels a lot different than I'm aware that part of me is upset with you.
Yeah, exactly. That's been a huge shift for me. And I think it also lines up, at least in my experience, with the idea, like within mindfulness, that there's an observer,
Hmm.
that I'm not my thoughts, I'm not my experience, um, that I'm the one that's observing, right? So
Hmm.
it's almost like being able to dive into that idea at a deeper level,
Mm-hmm.
and have more nuance, as you know already named.
Yeah, I'm glad you bring that up because mindfulness practice is such a great practice, and it helps us be with our lives and here for it. And as my sense is, you may agree, but I'll just keep it over here. Internal family systems takes it beyond mindfulness, so we can notice that sensation in our body. We can notice that inner critic, that voice that comes up. And my study of mindfulness would have us notice and kind of disidentify or just be with it as it is. Whereas internal family systems does that, yes, and then we build relationship with it. And we're not talking about every fleeting moment or thought or something like that, but if we're paying attention, we'll soon learn kind of the usual suspects, or like the cast of characters that come up in our life, kind of like who's who in your zoo will start to emerge, and we can get to know them and actually be in relationship with them in a way that a loving, grounded, needs met parent would relate to someone who's depending on them. These parts are depending on us. We can relate to them in that manner. So IFS, that I know your audience is somewhat familiar with, it's kind of taking attachment style or attachment theory inside, and that we can relate to these younger parts, even the ones that um, another part of us would rather get rid of. We can just to stay with the inner critic. We likely have other parts that are like, oh, this inner critic, he kind of bashes me. I want to get rid of it. Okay, hello, part that wants to get rid of the inner critic. I see you. Maybe if you're willing, you could step aside and we can get to know this inner critic a little bit more. Okay, but only for 5 minutes. Okay, great. We turn towards the inner critic and we actually kind of interview it or talk to it as if we would a young human. And then we start to learn. We bring curiosity and we start to learn what job it's doing, how long it's been doing it, what it really wants for you. And then the system, that part tends to soften when they know that you're here, your core self, higher self, capital S self in the IFS model, is here and listening and available. And that also that you're leading. That this part might have an idea that it has to like protect you in all these ways. But we begin to update it, that it actually isn't like that anymore.
I'm so glad that you just said everything that you just said, because that was my follow-up question: is how can someone start
Hmm.
to develop that relationship and have those conversations with their parts? And obviously, I mean, working with a therapist or somebody that is IFS trained is ideal, but not always accessible in the
Mhm.
moment. So what are some other things that people could do to start to develop those relationships with their parts?
Great, and a great question, and some resources for that. I would recommend reading No Bad Parts. That's Dick Schwartz, the founder of IFS, latest book. And also, he's done a lot of podcasts, and you may want to tune into those. He also has some demos online where you can see the work in action. And then from there, I hope that it inspires you to take on a practice of noticing your own parts. And it might feel a little funky at first. And I mean, starting any practice, one of the hardest things to do is to remember to kind of practice. So you might even give yourself a little reminder, put an object on your desk that you're always at, or a post-it, or wear a piece of jewelry a little bit differently, or just something as a reminder that's kind of infused with this intention to notice your parts. What are parts? Parts can be thoughts, sensations in your body. They can be patterns that you're aware of. Oftentimes they're kind of beliefs that you'll hear being expressed in different ways. And if you just open with the intention to notice parts as parts, and then maybe next, just to give one more, would be to start to speak to them or for them. So you might be in a conversation with someone, and while part of me, and just that as a beginning part of a sentence, there might be the thing that you're going to say is like, I feel like I'm really scared, or I'm concerned about this thing coming up. And you might practice saying, part of me is really concerned about the meeting later, or part of me is concerned about what's happening in this situation. What this does, bringing the intention into the language, it can help to start to unblend or have us separate from these different aspects. Parts are part of you, but they're not all of you. And you, at the center in your own core seat, you can get to know these parts of you and actually relate to them. So that's gathering up some and listening into some or reading some resources about IFS, and then being curious and having an intention to notice your own parts, and then maybe even speaking for parts.
Thank you for sharing all that. And I love the second one, especially. It's very reminiscent to what I suggest to clients with mindfulness. So just again, it's kind of keeping it in this realm of awareness. It's like, yes, we need to have a sitting practice or something that we're doing on a regular, longer basis,
Mm-hmm.
but it's also about finding those little micro moments throughout the day, and whether that's setting an alarm on your phone or noticing if there's certain sounds, for those of us that are sitting in front of a computer all day, maybe that email notification, or,
Mm-hmm.
for me, I tend to find noticing the sound of birds will kind of bring me back into awareness, but just something that kind of helps to trigger us to come back and be present, be aware. So I love that feels so congruent with what we're talking about.
Yeah, great. I love that you bring in the nature. Birds, if you're in an area where you hear birds, wonderful. Let that be a trigger, or in a tiny way, like a pattern interrupt. And it's more likely to happen if we set an intention for that. So the next time you hear a bird chirping, you might take a few extra moments with it. It might seem a little silly, but you could even thank that bird as being kind of this reminder to call you back to presence. And then maybe you feel your next breath or so. Yeah. And then, of course, the technological things. Yes, I set alarms as reminders for myself. And yeah, let's use our technology to help us be present.
Yeah, like you said, teachers, right? Having these different teachers. I love that idea. And I know one of my sort of informal teachers, Thich Nhat Hanh, was one of the inspirations for some of these ideas for me. I remember hearing a talk with him talking about the business offices in Plum Village and Deer Park that are staffed by monks and nuns, and that in the meditation hall we can use the sound of the bell as this reminder to come back to the present.
Hmm.
But in the office, it's like when the phone rings or when the email notification goes off, that's the sound of the bell. And we have the choice to slow down, to breathe, to come back to
Hmm.
ourselves instead of going, oh my God, I have to get this email, or,
Hmm.
oh no, another phone call. But that we can transform anything really into this, bring it into the path and into the guiding and facilitating more awareness within our daily life.
Agreed. And one thing I'd add there is the power of starting small. So it doesn't have to, if the phone rings and that has a big charge to it, maybe it's a ding on your computer in a different way, or it's you setting an alarm with a particularly distinct chime that really kind of just invites you into that more. Um, and then if that doesn't seem to kind of catch any momentum, what would be a smaller um, practice to do?
Nice. I love that. So to start to pendulate a little bit, um, you know, I love IFS. I think it's been great for me, and we've talked about it on the show before. But I'm really curious about your area of expertise where you're blending IFS with ketamine-assisted psychotherapy, and
Mm-hmm.
like how those two worlds interact with each other. Because I've never experienced that before. I'm very curious.
Yeah. In two words, very well. um, so we take internal family systems, which is this non-pathologizing, evidence-based model of psychotherapy that invites all parts of oneself, and that holds that behind all these parts, there's this we each have innate inside of us this inner healing intelligence that is wise, it's curious, it's compassionate. Um, there's kind of these 8 C's that you can look up and see how it is kind of a litmus test to see if, like, oh, is self energy present? Well, here's a list of things that kind of hint and let you know that. And then we combine this with these powerful tools, psychedelic medicines, in this case, ketamine. And there's a number of ways of collaborating IFS and internal family, IFS and ketamine. And the model that I've um, chosen into, developed, have found to be really helpful is a psycholytic dosing with a particular container. So, as you know, most psychotherapy is kind of open ended. It's like, okay, we're going to find out if we're a fit together, we're going to get some goals, and then we're going to work until these goals work. That's great, useful, wonderful. What I have found, and particularly working with ketamine, is to hold it in a container. So typically that's 3 months, and we begin the same way with learning a history, finding if we're a fit, of course, um, and setting up goals. But with this container having a beginning, middle, and end, most of the people that I work with really kind of end up raving about how that was supportive. It wasn't, there was no end in sight. And of course, life goes on after the 3 months, but it's really what can we get into? And specifically, what practices, what patterns can we address, and what practices can we take on, and how can IFS and ketamine support that? So, do a number of preparation sessions, and then after they've met with an integrative psychiatrist on my team and prescribed ketamine, we work a number of ketamine-assisted sessions where they take ketamine and we continue the IFS work. So ketamine, an incredible medicine in of itself, It's in the World Health Organization's 50 most essential medicines. It's in every hospital around the world. It is an anesthetic, so that's what it was approved for, and that's its main use. We, in the therapy world, use it sub-anesthetic. So we're not putting people to sleep, but we are altering their state. And that sub-anesthetic dose, that can include both psychedelic dosing, which that's kind of the higher end, where you kind of go on a journey. The journey is mostly inward, and it tends to be, enter more of a symbolic kind of experience. So that's psychedelic dosing. The dosing that I do more often, or at least start with, is called psycholytic dosing. This is a low or medium dosing where there's an alteration, but we stay in conversation. You have full access to what's arising in your experience, and yet you can see it. The ketamine helps us see it from a different angle. It also helps create a little bit more space from parts, or it kind of dials down parts, but they're still there. We wouldn't want to knock them out completely because we actually want to get to work with them. So preparation, and then the navigation sessions are working with ketamine, followed by each ketamine-assisted session has an integration session. The next day, no medicine. And we might repeat that about 6 times, ketamine-assisted, followed by an integration session, and then some concluding integration sessions towards the end of the 3 months.
What are some things that people might bring into those, especially since they are bookended, and I love that idea. But what's some examples of things that people bring into that to work with or work on?
I so appreciate this question, and the first thing that comes to mind, it matches to my experience in the MDMA for PTSD study, and then also the COMPASS study, psilocybin for treatment-resistant depression. For those studies, people have to come in and they say, hey, this is the trauma. This is why I'm struggling. And when people come to private practice, they have a story, they have an idea of what needs to change. And it's all very useful. It's necessary to know that. And what we get into in all these 3 streams that I just mentioned tends to be when the container is safe enough, and the focus is that, or it's known that all parts are welcome, then one's system, so the individual, whether it's the client or a participant in a research study, that which really needs their attention comes forward. So I'm saying this to say there's what people come in with, or what they mark on the paper as their trauma, and then what we get into. And what we get into tends to be even younger attachment challenges. So whether or not it meets a criteria for a disorder, or whether or not it fits in one of the categories of an attachment style, of an insecure attachment style, we tend to those younger parts. So from my experience and my point of view, what we work with is the younger parts that are really they're both the innocent young parts, and then they're the protective system that came in order to keep you safe, keep you protected. So we work with the protective system to get to these younger parts. Some of those symptoms or some of those things can be, most popular, anxiety and depression, confusion, disassociation, relationship issues, addiction, and that list goes on. But underneath that are younger parts that feel like they're cut off, disconnected from the system, and these protector parts have been running the show for a long time.
So are you saying that the things that people come in presenting with, or that they feel might be the issue, like you named anxiety, depression, addiction, things like that, those are an aspect of the protector parts that are kind of keeping those younger traumatized parts safe?
That's right. Yeah. So anxiety, depression, they are signals of something going on underneath. And we can It's not just, oh, you shouldn't be feeling anxious or depression. Let's get to the what's underneath.
Just get
Oh
over
no. Yes, right? Just get over it already. Come on.
it.
But rather we turn towards, we embrace the anxiety. We get to know how hard anxiety, the part that's carrying the anxiety, how hard it's working, what its concern would happen if it stopped working. And it might share with you examples. Well, there was this time that we weren't hypervigilant and we got hurt. Oh, okay, got you. Let's update that, see how that kind of unfolded. And in one way, I'm really facilitating a conversation between my client's higher self and their younger parts. And from that, they are building relationship. There's updating going on, and we're kind of coming into right relationship. It's almost like, actually, very much like if there's a young or parentified, or let's just say one of your nieces, your niece or nephews, 4 or 6 years old, if they felt like they had to take care of their parent, that would be kind of a task, even if it's unconscious. And that starts to limit that playfulness, that joy, the curiosity that was naturally flowing through them. No one told them, hey, you should be joyful, you should be playful, right? It just rolls through when unabated. And so we work with that protective system to know and even update them like, actually, young one, you don't have to take care of this situation. I'm here. I see you. And then it literally frees up energy. Depression, even the name itself, you can think of, or it comes to my mind that something's being pressed down, and the volume kind of turned down on it, or anxiety turned up in a way that we can't be so present. The work with the protective system, and then the younger parts, it really frees up energy for us to be in our own natural harmony, living life.
Thank you so much for explaining that. It feels very resonant to me, with what I believe and what I see in my work, and really neat to hear about it from the parts perspective. I feel like I'm often exploring it from the lens of somatic experiencing. But it's very similar of like, we don't have to be upset or feel shame or guilt around the state of the nervous system. That's how our system has protected us.
Mm.
That's how it's dealing with dysregulation and the natural drive to regulate, to
Mm-hmm.
not be living in this constant state of survival or fear or just being out of whack. And additionally, it's very curious for me. I work a few days a week in a residential treatment center, and it's interesting working with the folks that come in for what you might call shock trauma, or the more commonly things that we see trauma wise that are more commonly accepted, whether that's war or assault or car crash or things like that, versus the complex things. And sometimes people come in and they're like, yep, well, I did 2 tours and this is what happened, versus the folks that sit in my office and go, yeah, I had a great childhood. My parents didn't do anything to me. I don't have any trauma. And it's like, cool. Well, let's just get curious about why you're here then. And, I don't know why I can't stop drinking, but there's nothing bad happened to you. There's no trauma. So yeah, I really appreciate you bringing that in. And it was almost for like, it wasn't asking because I needed to know, but more because I wanted the people listening to really understand how important this is.
Yeah, and I dig what you highlighted there around somatic experiencing, where it's in one sense an equalizer of, we're going to get to your body and we're going to listen to your body. So it doesn't have to, make a headline. You don't have to be a war hero or suffer something that other people can go, aha, okay, that person should be struggling. It makes sense. It could be something very, and it could be something very personal, very never spoken before. And there's a case to be made that actually being alone with it is quite an amplifier of that trauma. The complexity, just to name that, one of the reasons things get complex is because of the impossible bind that we find ourselves in as young humans. We come into the world, and it's like we start on level 3 or something. Like we weren't even so conscious at the beginning of this life. Then we come into our consciousness and we find ourselves already kind of being seen or established somewhat in relationships or this world. We rely extremely naturally, heavily on the parents and the adults around us. And we find, or we know that we have to stay connected. And at the same time, we have this natural drive for authenticity. We don't know to cover up. We don't know to pretend. We don't know to not share this or not share that. So there's, or what's allowed or what's not. So we're in a process of finding that out. So it's complex because we learn about relationships from being in dependent relationships. Our baseline understanding of relationships is we're dependent on them. We're going to have to figure out what to do to stay in relationship. So that is quite a thing to navigate, especially when you're 3 or 5 years old and don't have much context of the world. So the layers, my point here is the layers run deep, and protective system kind of comes online around that, and that we can get to know this. We can peel back and get to know who's who inside, relate to them, let them know that they have a place at the table. Parts tend to become like quote unquote troublesome parts tend to become more consultants rather than kind of trying to lead. So a hypervigilant part scans the room, has a sense of what's going on. Okay, great. One, we can't just get rid of that part, nor would we. Okay, great. So you have this ability to walk into a room and kind of know where everything is at. Okay, great. We can consult with that part rather than having that part hold the idea that if it doesn't get everything right, that we're in danger and something's going to go wrong. That there's a higher self, there's a presence online now that can notice that and be with that without having that part lead the show.
Beautiful. I've shared about this on the show before, but I feel like my SE practitioner almost tricked me into doing parts work. We didn't sit down, at the beginning and say, hey, this is what we're going to be doing. But over time, identifying with different sensations in my body, especially going into particular traumas, especially the complex ones around, attachment and things like that, I started to pick up over time that like the different parts had different somatic, almost like signatures. And I started to be able to identify it. Oh, this is that 4-year-old part that's like in that abandonment wound, things like that, where the sensations would feel so different from each other. And so, yeah, I often joke with them that they sort of like backdoored me into parts work in a very helpful way.
Yeah, great. I love that. I hear you both. Like then you were set up to build relationship with those different parts, and I can appreciate the back door, or just it actually speaks to just how these practices are actually quite innate, and that they, we're used to relating people in the world, right? We meet people, we're like, oh, I kind of like them. I might want to be friends with them. I'm going to be curious. I'm going to ask questions. I'm going to share about myself. Same thing when we take that inside. So we can build relationships in the same way on the inside. And it reminds me, it was through EMDR training a long time ago. at Esalen. Laurel Parnell was teaching at Esalen, and I got a big hit around a part of me. And this is just before I learned about IFS. And it was in between sessions. So we were kind of doing these mock sessions. And then a facilitator came over and was asking me about it. And then we just kind of impromptu just kind of set up this scene where I was looking at and speaking to a younger part of myself, which was a very powerful moment. It's actually the most powerful moment of the whole training, which was very much like IFS before I kind of knew the language or the model. So bless all and thank gratitude for all teachers everywhere that just kind of come with what feels true and resonant versus having to kind of stick into one model.
Yeah, I love that. And I love that you mentioned it, because it was a thought that's been kind of playing through my head throughout this conversation, especially when you mentioned, a while back, you said something about that we have this inner guiding intelligence or inner healing intelligence. I forget exactly how you put it, but I went, oh, that sounds like, the work that I do within, holotropic breath work and other types of breath work, and, kind of based on, the ideas of Dr. Stanislav Grof. And so I, as a relative newbie to this world, right, I'm constantly finding joy in the synergies and the things that where I'm learning it in one training, but I'm like, oh, I kind of already know this, or I've been introduced to this idea before, like you called it this instead of that, but it's all working together and helping me to have a more well-rounded and integrated view of the world and how I can show up with other people, show up for myself, and show up for clients, rather than being these different silos that, okay, now I have this merit badge and now I have this merit badge, and they're not really like overlapping at all.
May we always be newbies. Yeah, agreed. It's like when and there's plenty of causes and conditions, personality types, or just ways we learn. Some people learn better than others. And there's such juicy cross-pollination between, like, my IFS work is extremely informed by the training I did in somatic experiencing. And even EMDR and Gestalt and a number of other things. So I'm appreciative of and on the underneath that, the psycholytic, psychodynamic understanding and developmental, all the pieces come together. And we boil that down. One of the biggest things that has helped with, as far as like professional work, is my personal work of knowing what's arising in me and having established relationships with my nervous system, with the parts that might come up when working with a client of like, oh, how are they doing? Are we approaching their goals? Oh, that's a scary thing that they just said they've never shared before. How am I responding to that? Knowing myself and knowing my system helps me stay in what the IFS model would say is like in self or self-led, so that I don't have, self-like parts or just parts that want to, make the client happy or get somewhere with the client, but rather this open field to help them connect with their own innate inner healing intelligence. And that phrase, I believe, does come from Stan Grof, Michael and Annie Mithofer, who wrote the protocol for MDMA for PTSD. They studied with Stan a long time, and so it's really, there's this intersection of somatic work, holotropic breath work, and MDMA-assisted therapy.
Yeah, there's it. I'm going through the training right now through the Groff Transpersonal training for being a holotropic facilitator, and I've remarked a few times that with one of my mentors that I'm working with, that one of the things that I appreciate about that program and specifically about the container the most is that there's times where I'm thinking something that feels very unsafe to express, to communicate. The narrative that I have inside is, if I say this, I'm going to be ostracized, or I'm going to be kicked out of
Mm-hmm.
the training. And even, recently, like last month, I was at a training module, and I had this moment where I thought, is this really what I want to get into? Like, this is a lot to hold, and this is what you're signing up for, really?
Mm-hmm.
I don't know. Like, I, I like this depth of the pool. Like, I'm used to a certain depth of breath work.
Uh-huh.
Holotropic is like a lot deeper, and
Mm-hmm.
I don't know. And it felt really scary to admit that, to say it out
Mm-hmm.
loud. And yet, whenever I do, I'm never ostracized. It's like, well, yeah, of course you feel that way. You're a human being. We all feel that way sometimes.
Mm-hmm.
And so not only does that feel validating, but it also, some of the advice that I've been given is, yes, and we hold it, we notice it, we don't try to push it away or hide it or pretend like it's not a part of the experience.
Yeah.
And yes, we're going to be in these moments where we're working the floor, we're supporting other people in their process, and maybe I can only see and acknowledge that part momentarily because I have a
Mm-hmm.
job to do. It doesn't mean that we try to bury it.
Mm-hmm.
It's like, yeah, after the session, then we can go and do our own work and work with that. So that it also kind of reminded me of what you just shared in terms of when we're sitting with somebody, when we're working with someone, and they're sharing something that feels activating, or like something that's big to hold as well.
Yeah, before we hit record, I shared that I look forward to the next time you're in Los Angeles. I'd love to sit in your breathwork container, and this just amplified that even more. Your willingness to open to and connect with that which is scary in you provides a safer place for others to do the same. The trust that you continue to build in yourself is probably the primary thing that we can bring to people that we're supporting and opening with. So, and then just to take that again, kind of in a broad stroke, what we're inviting, or one way to talk about healing is building trust in your system. That the parts of you that have been really scared and sometimes hijack and kind of blend with you or take over the situation. And it's the reason that as adults, we act like young kids sometimes. And the reason that gets highlighted is because, like, oh, wow, that adult person over there doesn't seem like they're acting really young, like they don't have the resources or they don't have the space or they've lost the context of the situation. Yeah, that's absolutely what is happening when we're panicking or freaking out or shutting down or staying stuck in certain patterns because our systems don't trust yet that we can lead. We, the you, the core self inside of you. And your willingness to, and I kind of heard it along the way, it wasn't a dismissal, hey, I shouldn't be feeling this, but rather, oh, okay, I'm gonna, yes, and include the part that's concerned if I say this. And we can meet and be with that. And then we can you can get to know that fear. And then you have the options to share it or not. Without that, you or any of us would be kind of shutting other people down. Like, whoa, it's too scary in me. So I'm not going to consciously, unconsciously let you go there into that scary place that needs your attention.
Yeah. And it's scary to work with it sometimes, for sure. Like,
Mm-hmm.
I mean, talk about getting into the depths of like my biggest fear, it's like, not just admitting that there's something there inside, right?
Mm-hmm.
That, especially I feel like within the holotropic container, because
Mm-hmm.
there's such good role models that
Mm-hmm.
are in those containers, like working the floor.
Yeah.
Um, I learned so much just from sitting and watching them, do their
Mm-hmm.
own work.
Mm-hmm.
Um, but to know, yeah, like we're not perfect too,
Yeah.
you know.
I love that the Groff model really kind of dissolves the hierarchy of yes, there's expert knowledge and there's roles that are being played, but as you shared, you watching the people that you're learning from do their work. I think of Dick Schwartz, founder of IFS, and how he is continuing to work his process, getting to know his parts. He might refer to a disagreement he had with his partner and kind of what's coming up for him. He continues to get assistance. Like here it is, the founder of a model asking a colleague for some help because parts, the real sticky ones, are the more that we get into. It is so helpful to have someone else hold a space to kind of let us unblend from those parts. Some of the real sticky ones kind of need that, and for the sake of that, like I don't know what yours boils down to, but mine is a fear of, I mean, ultimately like disconnection or being alone. Like I'll be cast out if I don't do things in a certain way, or if people really knew. That's one phrase that will come up inside. If they really knew, yeah, yeah, but if they really knew, and then this feeling of being, or the fear of being isolated, cut off, let alone, that is terrifying to parts of me.
Thank you for naming that and for sharing it.
Mm-hmm.
And it's something I can certainly relate to. um, well, I mean, this has been an amazing conversation, and I know we're going to have to do a part two because we talked about getting into so many other things before
Mm-hmm.
we started recording. And yeah, I just want to name that that's a joyous place to be in. It's much better than sitting here going, I can't wait for the hour to be up. Yeah. I guess one other curiosity that I have around parts work, especially in the context of more inner work and integration. We've talked a lot during this conversation about working with parts of ourselves that have been exiled or maybe that we're having trouble relating to.
Mm-hmm.
What about parts of ourselves that we want to um, maybe like encourage more, or parts of
Mm-hmm.
ourselves that we really already like?
Mm-hmm.
I guess the context of my question is, when I first started doing somatic experiencing, it was for trauma, and
Mm-hmm.
it was for working with this especially complex trauma.
Mm-hmm.
And yet the more that I've done, as not only as a client, but as I've gotten into the work being a practitioner, the more that I see that just using SE as like a trauma method is really just limiting
Mm-hmm.
what it is, and the potential and capacity for the somatic experience to enrich one's life and to really feel more embodied and integrated, to not only work with the things that trigger us or activate our nervous system, but those little moments, the chirping of the birds, the hug or a compliment from somebody,
Mm-hmm.
or just the little nuances. I guess sometimes we call them glimmers, right?
Mm-hmm.
The positive things in life.
Yeah.
So could you speak a little bit about like how IFS can help or integrate with that piece?
I'm so glad, Jonathan, that you are bringing this up because all of seemingly most of psychotherapy, even kind of self-help or most things, it's like let's focus on what's wrong and get rid of that
Right.
so that this other things. What that is not my experience of the most effective or even efficient way. Certainly not the optimal. And different from that is turning towards, honing in, and even amplifying the parts of ourselves or aspects that we really want to enjoy or embody more. So, yeah, as you were speaking, a couple things came to mind. Like I've had my own um, growth spurts in with a couple dear friends. We did the Artist Way, if you're familiar with that. So
Yeah.
a couple several week program, and you just grab a couple friends and watch what unfolds. It's a very safe container to get to know some creative parts of yourself and to put them in practice on the daily. Another one is just like dancing, like moving or being in relationship with your body. Most of us have stories or ideas about our body, what it is, what it what it has been, how it's maybe even betrayed us in ways. But there's a way to turn our focus towards and appreciate and love our body here as it is. And essentially, anything that brings about more presence, and I mean this in relationship, in sexual relationships, explore sexually. Like there are parts of you that are calling for your attention. And as we've kind of kept with the yes and that we can put the information into our system that you can say that you are open to knowing all parts of yourself, and then notice what arises and listen for the yeah buts. Like, okay, yeah, this is all socially acceptable, but what about this? um, yeah, so I guess I'll leave you with that, the curiosity of these parts that maybe haven't had your attention, that are yearning for it. And you can set up the space literally 3 minutes in the morning, set a little timer with a sweet little bell, and just asking inside what needs your attention today. And it might be, oh, it's this concern, but it also might be, I gotta play more. Well, what's one way? It's like, oh, well, I'm not good at that sport, or I'm not good at this thing. Okay, the nature of play is not goal oriented, so we can open towards more play.
I love that. And that is very resonant to my own experience. Yeah, more play, more movement just is has been a big part of what I would call, integration, and what I've taken away from my medicine work and from a lot of my breath work. So I really appreciate you naming that and getting and the fact that we got to sort of end on more of a positive note, and like, just, oh, by the way, this isn't just for trauma.
Yeah.
And just acknowledging that, yes, sometimes people are approaching inner work and medicine work because they feel like they need to heal.
Mm-hmm.
And even if they're not, they're probably, like we've said, we're going to get to a place where there's some things inside to heal anyway, right?
Mm-hmm.
But it's not just for that. There are people that are approaching this work for deepening their creativity or their sense of
Mm-hmm.
self, or they feel like they want to live a life that's more connected to what they call purpose. It's not just, hey, I've got these traumas to clean out of my system.
Mm-hmm. Yeah. And actually connecting with that helps us. It's a resource. And just briefly, like a psychedelic, a safely held psychedelic experience where we're yes and to things that are arising can be a resource for us to like, wow, this feels great. Okay. It's not, we can feel our own heart more, we can feel our own connectedness, and it's not do drugs all the time, but it's rather, okay, that's something that I'm intending and growing towards. What are small steps I can take to take care of myself, to connect with that more and more.
Love it.
Yeah.
Well, we're definitely going to have a part two and talk
Love
about
that.
the artist way, talk about more like psychedelic stuff, because I feel
Yeah.
like we stayed kind of in that IFS
Mm-hmm.
lane for the most part, which is
Yeah.
totally great. I love it that I love getting to know people where it is a multidimensional kind of conversation.
Yeah.
As a way to bring the episode to a close, my vital point is always like, regardless of what we're talking about, the important thing is to practice it, to put it into practice. Is there something in your work or in your life currently, or maybe just that came up organically in this conversation, that you would share as your vital point?
I mean, you got a good one. Might be the best one, according to me. But to add to it, or to set something next to it, it would be um, the flirting with the intention to habituate to opening. If the goal is opening, then it's not like, okay, I've achieved the thing. It's no, how am I actually being with this direct experience? Am I opening to what's here? And let that be grief, let that be joy, let that be more play, let that be to just peace and rest. Am I able to practice opening?
Well said. Thank you. Well, Dr. Nick Bruss, this has been a pleasure for sure. And I just want to let people know where they can or should get a hold of you if they're interested in learning more about your work, or connecting.
Thank you. My website is apracticeoffreedom.com, and my Instagram is Dr. Nick Bruss, Bruss. And thank you so much. It was great connecting with you. I really enjoyed the conversation and look forward to more.
Yeah, likewise. And I can't recommend, his Instagram more. I am always finding some inspiration there. And yeah, it was great. Like especially the things you've been posting recently have been really like spot on, I feel like. And yeah, just good jumping off points as far as, not only my own, what can I bring into my work, but, for conversations like this. So really, really appreciate the work that you're doing out there in the world.
Appreciate it. Thank you.
Wow, what an amazing conversation. There are many parts of myself that are very happy right now. And I hope that you found it inspiring as well. If you're enjoying the show, please make sure you leave a review, comment, follow, subscribe. If you can share it with someone and, follow, subscribe, that really helps us continue to grow. You can also connect with me more directly at bluemagicalchemy.com and join our newsletter, as well as explore opportunities to meet one-on-one for coaching. Make sure you connect with Dr. Nick Bruss at apracticeoffreedom.com and on Instagram at drnickbruss, Bruss. We'll have the links for that on this show page. And remember that it's not about the method you choose or the pace at which you travel. The vital point is to consistently show up for yourself in practice. As the saying goes, it's not the destination, but the journey that matters. And I'm honored to be a part of your journey. Please don't hesitate to reach out if you need support or just to connect and share your experiences. I'm just an email, DM, or review away. Thanks again for tuning in. Until our next episode, keep exploring, keep growing, and above all, keep practicing, because that's the vital point.